So one of the important parts of a system is something called key performance indicators. A key performance indicator is a quantitative measurement of a process that will very quickly let you know if this process is working or if there's trouble, right? We have a lot of key performance indicators we look at in a dental practice, and like production and collection are good ones, right? Those are ones that are very backwards looking too, right? At the end of the month, you look at that and you're like, how did we do? It doesn't really drive stuff. It's a reflection of what has happened. So better key performance indicators are going to be more granular. They're going to be like conversion rates, on phone calls. They're going to be daily, how many people left the office with their hygiene appointments scheduled. And then you can break it down as how many people out of hygiene left with an appointment, how many people out of the doctor's office left with an appointment. Those are the things, when you have these numbers, they drive behavior on a daily basis, and they're a little bit better. So when you look at your systems, you want to try to identify what are the key performance indicators. In the past, we would have to track these things on written or printed out sheets, enter them into Excel, and calculate on a daily basis where we're at for our key performance indicators, and then we could see over time how we're doing. The fantastic thing is you now have programs out there that will query your database in your practice management software and give that. The one I love the best is Practice by Numbers. It is an absolute fantastic program. It does so much in my practice. Things that I used to have 4 or 5 different subcontracted programs to take care of, and it was a lot of maintenance heavy. It does all of that way better than any other one. But they're all pretty damn good. They are going to give you a snapshot of your practice on a daily basis that you can then spread out over months. It's so much nicer than when I started. I have a Venn diagram that I'll try to put up. I'm not very tech savvy when it comes to videos, but I'll try to put it up, and have a Venn diagram that I created on how key performance indicators are important. The 3 circles in this Venn diagram are incompetence or laziness, right? Another one is ignorance, and the third one is competence. And when you put them all together, where the incompetence and laziness overlaps with competence, it's that competent people can make up for incompetence and laziness, but they're going to get frustrated and overworked, right? Where incompetence overlaps laziness or ignorance is your ignorance of a process overlaps with someone else's incompetence or laziness. There can be big problems potentially. And that is where I found myself when I had to really learn the front office. The last one is when your ignorance is covers someone's competence. Your ignorance can be masked by someone else's competence, and that can be good or bad, because if that person is honorable, no problem. If they're dishonorable in any way, that's an opportunity for them to embezzle, right? Or damage your practice in some way. So the key performance indicator in the center of all those things is you can be ignorant of a process, but by still monitoring key performance indicators, it'll help fight against incompetence and laziness or somebody trying to pull the wool over your eyes, right? It's probably not the best Venn diagram, but it's mine and I like it. But that's what a key performance indicator does. You don't have to be the expert in every part of the process, but if you can monitor these key performance indicators and you can see something starting to dip, then the question is, what is going on? Why is this dipping, right? And you start digging into what are the systems that drive that key performance indicator and find out, are we dropping the ball on something? Is there something else we can train on? The important thing about KPIs and numbers in a dental practice is they can never be punitive, right? If they are punitive, people will dread talking about them. If people are yelled at because numbers are down, then they are going to do things to try to hide the numbers from you, right? They will manufacture stuff so it doesn't look as bad because they know they're going to get in trouble. So numbers are never punitive. Numbers tell a story. And we need to say, why is this happening? And dig down and then train, right? It's all to guide our training and our education on how we can move this up. Another thing with key performance indicators is the tendency to blame. Not blame people, but blame something, right? Well, the economy's down. There's 1,000 things. The weather's bad. There's 1,000 things we can talk about. And it is true that that might be one of the main reasons it's driving it. The problem with that goes back to what Stephen Covey used to call the circle of influence and circle of concern. Your circle of concern is everything you're worried about, right? Everything that could be happening. Your circle of influence is inside of that circle, and it'll never encompass it completely. That is stuff you have direct control over, your circle of influence and your circle of control. So when you focus the reasons for whatever is happening, when you focus on reasons that are outside of your circle of control, outside of your circle of influence, and in this great big nebulous of, crap happens, you have no control, and it breeds frustration. It breeds, wanting to quit, bad feelings, the world's against me, blah, 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 blah. And you go nowhere, right? And everything stagnates. When you pull back into what you can control and what you can influence, you can now make action plans and you can start moving towards something. And what you'll find is many times, even though you believe the problem is outside of your control, when you focus on what you can control, things get better. Things get better. Examples of this would be, the economy's bad, right? The economy's bad. What can we, that's why people are doing this, canceling their appointments for everything. Okay, the economy might be bad. I can't fix the economy. So what is within my circle of control right here? How are we talking to our patients? How are we, and you're going to hate this, building value, which I will address at one point. I hate that as a catch-all term, but when you dig deeper into building value, it makes sense. So building value for what we're doing, giving them options, giving them every opportunity to say yes, and then following up over time with people and not losing your motivation. One of the things I always quote is be more committed to the process than the results, right? Be more committed to the process that you are doing rather than the results that you get. And the results that's how you get better results. If you read the book Mastery, I love that book, and they talk about practice and about learning to love a plateau and working hard in that plateau in order to gain the next thing. Anyway, so key performance indicators, I kind of got off on a tangent, but key performance indicators are those things that allow you to monitor the systems in your practice for health, and then you can dig down deeper and figure out why it happened. For example, we want every patient to leave our practice scheduled for hygiene. We would love to see 100% of that, right? Our goal is more like 95% office-wide and about 98% through hygiene. So at the end of every day, we have a system through our hygiene program and also through the clinical program with our checkout, with our handoff and checkout, and also with, ahead of time in the huddle to identify who is not scheduled ahead, right? Who didn't schedule, or to schedule people ahead. The end of the day, at the huddle the next morning, we look over the previous day and we say, what percentage of people left our office with a hygiene appointment? What was our schedule ahead rate? Sometimes it's 90%. So then we open that up and say, who didn't schedule? And we talk about each one. And sometimes you find that this person moved, was going to college. And every now and then you do find that we missed one, especially when it comes out of the doctor's schedule. We missed one. Maybe they came in for a limited exam and we haven't gotten a comprehensive yet. Or they left without having one. When you talk about that every day and you focus on that KPI, we can then work on our systems, and it brings it to the forefront of everybody's mind. So that's an easy one to look at. So when you design your systems, design key performance indicators, or look at what key performance indicators. Many times a key performance indicator is what I say is a quantitative, messed up. Well, a key performance indicator is a quantitative measurement of a qualitative process, right? So when you want to see what percentage of people scheduled for treatment and how much treatment did everybody schedule for, to another really important KPIs, what drives that people saying yes to treatment is a lot of the way you interact with people. And it's hard to measure an interaction, and when you start to measure interaction, it gets uncomfortable for everybody involved. So that key performance indicator is a quantitative measurement of how you treated people. So when it's dipping, sometimes you need to talk through your system on how we're talking to people, what the environment is around, how are we smiling and looking, those types of things, and do better training or try to find where the friction is that's driving that down. All right, the next thing I want to talk about is what I think is the most important system in a dental office, and that is how you answer the phone. So I'll get to that next.